have your Miller Colson Academy membership kind of in an interesting place in your office, down in the corner there. Can you tell us a bit about why it's there?
Well, maybe I ran out of wall space.
Possibly, yes.
I have my kids' finger paintings up there from preschool on the wall, but the Miller Colson plaque award is down near the floor.
Sure.
Really, I think that there's so many clinicians here that deserve recognition that I don't put myself in a special category, because everybody is playing their part in providing care in the way that they do it. I think somehow we just got recognized for what we do. So people think that in anesthesia your patients are asleep, you don't need to talk to them. Actually, I think the opposite is true. You get a very brief but intense period of time, maybe 10 minutes, before the case starts, to allay their fears,
Mm-hmm.
Win their trust, and to meet and greet and even allay the fears of the family members.
Sure. You yourself have had 6 surgeries. How does this inform your philosophy of treating others the way you'd want to be treated?
I think every doctor could be a better physician if they spent some time on the other side. You really don't know what it's like, how vulnerable you can be until you've been a patient yourself. My first real interaction with the health system was 30 years ago, a bicycle versus car. I was on the bike, and I was helicoptered to shock trauma and had an emergency splenectomy. I mean, my other surgeries were just like knee arthroscopies and a broken hand from another bicycle accident. But until you've been on the other side and been laying in the bed, to know the fears and the pain and the vulnerability, you really don't know exactly what's in your patient's head.
You emphasize the importance of members in the operating room beyond the surgeons. Who are they, and why do they deserve our recognition?
Everything we do involves a team of people working together. Medicine's so specialized now that everybody kind of wants to do their own little thing in their own little niche, but when it all comes down, the patient's in the middle, and patient-centered care involves everybody from the scheduling coordinators, to the CAT scan technicians, people who keep the ORs clean and safe, to the nurses and the nurse practitioners, physician's assistants, residents, fellows, attendings. That's at least 10 different kinds of people I can name off the bat that need to all work together. Everybody needs to pitch in and be recognized for the value that they provide.
Dr. Frank, thank you so much for your time.
Thank you, my pleasure.
That was a CLOSLER Look.